Good afternoon, everybody, and thank you for joining me. Today I'd like to talk about the situation in New South Wales and Commonwealth Government support for the people of New South Wales on the health front, and also the work that's being done on economic support and mental health support, as well as the update on the vaccination program. But the first thing is to acknowledge that this is a difficult and challenging and stressful time for so many people in Sydney and more broadly across other parts of New South Wales and across Australia. Virtually every Australian will have connections with friends or family who are under lockdown and who are facing pressure and concern about their health, potentially their mental health, and about their economic circumstances. In order to assist with that, the Commonwealth will be making a health support package available. That's been approved by the Expenditure Review Committee of Cabinet today, or the Budget Committee of Cabinet chaired by the Prime Minister, and that will include support for general practices, for pharmacies and for allied health practitioners. In particular, we will make from the National Medical Stockpile through the 7 primary health networks of Northern Sydney, Central and Eastern Sydney, Southwestern Sydney, Western Sydney, Southeastern New South Wales, Nepean Blue Mountains and the Hunter New England and Central Coast primary health networks, the following package available. 1 million surgical masks, 1 million N95 masks, 250,000 pairs of gloves, 250,000 gowns and 250,000 goggles. These are to assist in infection control, to support our health practitioners as they support the community. It's a recognition that whilst they may not all be required at this point in time, they will be made available through the primary health networks, and to our doctors and our nurses, to our pharmacists, to our allied health workers who are conducting essential services. I want to acknowledge and thank you. I've spoken both with the President of the AMA yesterday and the Vice President today. I've spoken with the head of the Royal Australian College of General Practitioners, Dr. Karen Price, today, as well as the New South Wales Health Minister, Brad Hazzard, and the New South Wales Mental Health Minister, Bronnie Taylor. And all are pitching in, and our support is to provide that health support, which is to assist our amazing professionals who are taking care of Australians whilst keeping both our health workers safe, but also keeping the public safe. In addition, I would note that the Expenditure Review of Cabinet, as mentioned, has met and is also in advanced discussions through the Prime Minister and the Treasurer with New South Wales on both an economic support package and a mental health support package. The stresses that families, workers, businesses are facing are real and significant. The Prime Minister and the Premier have been in constant engagement, and I know we met yesterday as a contact group with the Prime Minister to discuss arrangements. Those arrangements were taken forward today, and it's expected to be completed with New South Wales in the very near future. So these are supports to assist people through the difficult, challenging lockdown period. But I will say this. We've done this before. We've done this nationally. We've done this in other states and territories. We've been through this in Victoria, where we are now. And we'll do this again in New South Wales. And there will be moments of distress and uncertainty. And, of course, the health impacts are uppermost on our mind. But as a national government, we are stepping in to support the New South Wales government, stepping in to support the New South Wales people, and stepping in on behalf of all Australians. In relation to the vaccine rollout, I want to thank all Australians who have been coming forward. Over the course of the last week, we have had a record number of vaccinations again, 894,344 vaccinations were delivered across the nation. That now takes it to a total of approximately 9.15 million vaccinations, and that includes almost 6.8 million individuals who've had a first dose, or 33% of the nation, and 2.325 million individuals who have been fully vaccinated, 11.3% of the eligible population of 16 and over. Very significantly, because whilst COVID can affect anybody, its severity increases with age. That's the single strongest determinant of the likelihood of a severe outcome, although sadly, as we've seen in New South Wales, it can have severe outcomes on anybody. But very significantly, we now have, for the over 50 population, 56.5% of the nation have had vaccinations. For the over 60s, 65.4% have had vaccinations, and for the over 70s, a very heartening 73% of the population have had vaccinations. And my message is very clear. If you are over 60, please do not hesitate. Please come forward for your first dose. Please come forward if you have had a first dose for your second dose. Do not wait. Do not wait for either if you are eligible, and whether that's you are eligible for AstraZeneca as an over 60, or you're in another group with access to Pfizer. Please do not wait. And for the rest of the population, to everybody in Sydney, thank you. You're doing an extraordinary job. Staying at home is difficult. We've been through this here in Victoria. We know you can do it. We know you can do it, and you will. But as part of that, this week we're expanding the general practice Pfizer program rollout that will lead to a further 500 GPs around the country that will be able to distribute Pfizer. And all of this opens up more points of presence, more opportunities for vaccination, and as those numbers continue of increases in vaccination, there's increased protection around the country. Lastly, the three key messages for people in Sydney who are affected by the lockdowns or in the broader areas: stay at home. Please stay at home. You've been doing an amazing job, but continue to do this unless it's for the essential reasons. If you do have symptoms, however, please be tested. Do not ignore the symptoms. Please come forward to be tested. And if you are eligible to be vaccinated for your first or second dose, please do not wait.